surgery, if you recall. How's the knee? That's where the surgery was done, but if the knee is feeling okay, then I'm just going to be doing an entire full body exam today on you, just to make sure that everything is crystal clear and healthy on you. It's going to be a thorough exam today from top to bottom on your body, making sure that all of your joints, all of your peripheral visions, everything works. So I need you to be patient with me, and I need you to stay there as long as you can to make sure that you can see the full examination through. How does that sound for you? Great. So the first thing we're going to be doing is I'm just going to be looking at the top portion of your head, going over some cranial nerves, seeing how those look, your eyes, teeth, hearing, facial structure, making my way down your neck, into your arms, into your center of your body, around your waist, down your legs on either side, into your feet. We'll then be looking at your back, just very briefly, and then after that marker, we'll be able to see you at the front to book you for your 6-month follow-up. How does that sound? Excellent. That's what I like to hear. So we are going to start with the face. So I'm just going to grab my pen light, and what I want you to do is the first thing I'm going to look at is your eyes. Okay, so Yep, we've done this before, I know, but it's the standard medical doctor's examination process, sort of the routine that we're going to follow. So just, stand there, nice and tall, eyes open. Tell me what side this is coming on when you see the light. What side was that on? Okay, and again, what side was that on? Great. I'm not going to tell you if I'm coming from the top or the bottom this time. You're just going to see the light, and I want you to tell me if it's top or bottom. Okay. Was that top or bottom? Okay, and again. Top or bottom? And again. You can see my arm moving, but that's okay. It's just to make sure that your motor functioning skills are looking good. I'm just going to come really in close and look at your eyes. So can you look up for me for a second, please? Great. And then can you look down? Looking down. Thank you very much. That's excellent. And then looking up again. Just great. And down. Can you tilt your eyes that way a bit? Yeah, look sort of that way. Okay, then look that way. Okay, tell me when you can't see these eyes anymore. Sorry, these fingers. And excellent. How many fingers do you see? 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 Great. I'm just going to do the last little test here on your eyes to make sure that they dilate. So just stand there, eyes open for me, please. And coming in and out. In and out. In and out. Same thing, other side. And in and out. In and out. In and out. Great. I just want to test one more thing here, so can you just close one eye for me? We'll just close your left eye to start. Tell me when you can't see me anymore. Great. Tell me when you cannot see me anymore. Great. Just cover one eye for me. And cover one eye for me. When I did that, was I blurry or clear the entire time? Okay, good. Just wanted to check to make sure that your depth perception was good. So I'm happy with your eyes so far. So the next thing I'm going to do is I'm just going to have a peek around your jawline here, down around your neck, your ears, and then we'll do a hearing test in a second, okay? How does that sound? Great. So I'm just going to have a quick look at your jawline. Just, thank you. Okay, and I'm just going to look along the back sides of your ears here. other side. Okay, I'm just gonna look on your forehead here. Okay, I like what I'm seeing. No deformities or anything, no skin lesions or skin tags. Now I'm just gonna be doing a little test on either ear. So when you hear a noise, let me know, okay? Which ear is this in? Great. And now. Excellent. Tell me, what is this noise I'm making? Okay, and how about the other ear? That's right, snapping. Now, what type of noise is this? Sort of like a rummaging in the other ear. Again, what was that type of noise? Sort of like rubbing your hands together type thing, right? Good. Now, can you just look up for me? I'm just going to have a look at your Adam's apple. Okay, look sort of up just like that. Now, can you swallow for me? Just like this. Really emphasize your Adam's apple. Okay, swallow. Great. I'm just going to push it to either side. Have a look here. Just pushing here to the side. To the side. Great. I like what I'm seeing here. Nothing wrong with your facial structure. Your hairline looks good. I'd say so far on the head portion, we're good. The last thing, I just want to look inside your nose quickly, and then I just want to look inside your mouth. So if you can just tilt your head back a bit, just kind of a peek inside your nostrils. Okay. Can you just close one nostril? Okay, now can you just breathe out of that nostril for me? And do the same on the other one. Excellent. Now, just open your mouth for me. I'm just gonna have a little peek inside with my mirror, okay? So, can you just open your mouth and sort of stick your tongue out like that? Thank you. Okay. Okay, tilt your tongue to that way. To the other way. Put your tongue on top of your roof of your mouth. And then, can you put your tongue like as far down into your mouth as you can go? Okay, can you stick your tongue out and say ah for me? Great, I like what I'm seeing. Let's move on to the shoulder area now. Shoulder and sort of till the middle of your chest, stomach area, okay? So I'm going to be doing some motor functioning skills, getting you to shrug, getting you to resist, both forwards and back, okay? Alright, so on the count of 3, I want you to push your shoulders up while I push down, okay? On 3, 1, 2, 3. Now push up, 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 resist, resist, resist. Great. Now I'm going to try and push your shoulders up. I'd like you to try and push them down, okay? And resist, 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 resist. Great. I'm going to do one shoulder. I'm going to push down, and I want you to resist, okay? Okay, so put that shoulder up for me, and I'm going to push down and resist, 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 resist. Do the same on the other shoulder, and resist, 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 resist. Both shoulders up like this for me, and resist, 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 resist. Great. Motor functioning skills, muscle, no imbalances. I like what I'm seeing there. Just get a little poke along your clavicles here, okay? Just looking for any lumps and bumps. Just feeling along your shoulders now. Great, that's awesome. I'm just going to listen to your heart really quickly. I'm going to check out the chestal area down to the stomach, okay? Okay, so I'd just like you to take a deep breath. Breathe. Breathe normally for me. I've got this all nice and warm, so just, breathe normal, okay? Great, I like what I'm seeing there. Now, I'd like you to just take some breaths out while I listen again, okay? Alright. Just gotta find the spot here. Great. Two more breaths for me, please. Great. Nice and steady heartbeat, about 65 beats per minute. That's nothing bad. That's actually a really nice range. Are you a smoker? Have you picked up smoking at all since I saw you last? No. Any medications changed? No. How's your diet been? Good. Not a lot of cholesterol? Good. That's exactly what I like to hear. How about like butter, fatty foods? You've been trying to eat healthy? That's excellent. I really love when my patients try and eat healthy. It definitely makes my life a lot easier. Now, I'm just going to have you turn around for me really quickly, and I'm just going to examine your back, and I'm just going to ask you to say a couple phrases for me while I listen with my stethoscope again, okay? Okay, so just turn around for me. Okay, I'm going to put it on 6 sections of your back on the top, like this, sort of like 2, 4, 5, and 6, just like that. And then I'm going to get you to say the words 99 for me, okay? So go ahead and turn around. All right, just put that on your back there. Now can you say 99 for me? Okay, and again, say 99. Just coming down to the center of your back now, 99. 99. Just on the lower portion of your back, one more time, say 99. And last time, 99. Great. Lungs sound great. Both bilateral. Breaths sound normal. You have about 15 to 20 respirations per minute. That's exactly what we want. Nothing higher, nothing lower. So far, I'm really liking what I'm seeing. Now, I'm just going to be looking for any lumps and bumps along the front and then the back side of your chest and your back right now, okay? So, if you just sort of stand there nice and tall for me, please, okay? So, my hands are clean and they are warm. I did warm them up, but we'll do it one more time. Hands are now warm. Okay, so I'm just going to be coming alongside your lats here. Just down along your midsection. On the front side here. Just going to be feeling along in your stomach. I'm just going to do a couple taps where your pancreas, your liver, stomach, and everything is okay. So if you can just stand there, I'm just going to do a couple taps. Just coming up along to your chest area. Do a couple more taps here. Great. Doesn't sound like there's anything going on in there, no distensions or anything. Just turn around. Gonna have a quick look at your backside. Okay, gonna do the same thing I did on the front, just looking from the bottom up. Okay, so like what I'm seeing so far, very healthy, and your weight, just looking at your chart there, has been very stable. You've obviously been listening to my recommendations on what I've been saying to do the last 3 months. I'm sure at the 6th month, no problems. Now, I'm just going to be looking at your legs from your hips downwards. I don't need to come close to you at all. I'm just going to get you to do some movements for me. I don't need to feel or touch, okay? Alright, so I want you standing straight. I'd like you to lift your right leg for me. Can you do that? Great. And can you lift your left leg for me? Great. Can you put your left leg out like that? Sort of like that. Exactly. And go ahead. And your right leg, I want you to put it out like that again, sort of like a teeter-totter. Go ahead. Great. And can you squat down for me? Okay, that was good. Any creaking in the knees since we did that surgery? Did that hurt at all? No? Okay, good. Now, with your feet, can you sort of just take them and do them in circles like that around your centimeters, is that right? Okay, no problems there. So just turn around for me for 1 second. I'll just examine the backside and I'll get you to do a couple more movements. Okay, can you bend down and touch your toes? Great. Any pain in the back of the hamstring there from when we did that surgery? No? Okay. And just go ahead, put your leg out again like that, facing that way. Okay, your backside looks good. Normal, equal on both sides. Go again and do that on the other side. Okay, good. I'm looking at the center of your back there, just seeing how the hip movement is it equal? Is one going a little cockeyed to the other? No, but I like what I was saying. So you can turn back around for me, facing me, and I'll just get you to have your hands up and then touch your toes. Any pain with that? Okay. I'm going to get you to turn this way for me. Go ahead. And I'll get you to turn that way for me. Go ahead. Any discomfort with that? No? Okay. Now I'm going to get you to put your arms up for me. We're testing your motor function skills in your arms and then in your biceps and your triceps. So arms up like this for me. I'm going to push my hands towards you. You are going to push towards me. Okay, so here we go. I'm pushing onto your arms right here. I'm going to push and resist, 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 resist. Excellent. No problems there. Arms up again. You're going to be pulling yourself towards, like you're doing a bicep curl, and I'm going to be pulling away. Okay, arms up for me and resist, 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 resist. How was that? A little bit of discomfort in the bicep. Okay, is that just, you did a workout yesterday? Okay, that makes sense why your arms would be a little sore, but no problems there, right? Great. So what I'm going to do now is I've got a new tool, actually just a laser that sort of scans your body in whole, and it just looks for anything that might be going wrong on the inside that I couldn't see. So it's actually a brand new machine that we got. I'm pretty proud of it. So just got to start it up. One comes out. Okay, yes. Okay, so now I would like you to just stand there and I'm going to go up to bottom, down to top. Okay, here we go. And I'm just going to come back up now. Just going to read what the machine told me. Like I thought, nothing is wrong with you. It's a very detailed machine that gives me a lot of information in a short period of time. So other than that, we've gone through quite a few things. I forgot to do the color test. So let's do the color test just to make sure that your eyes are doing good. Can you tell me what color this is, please? And this color. This color. And this color. And the one in my pocket here. Where did that one go? Here it is. This color, please. Excellent. Now, how many am I actually holding here, and how many colors do you see total? The answer is 5. Great. So, with that being done, we've done sort of a full physical exam on you. I like what I'm seeing. Your diet hasn't changed. It sounds like you've done a fantastic job on listening to my recommendations over the last 3 months. So I'll see you in another 3 months. And with that being said, Margaret is just at the front there. She'll let you know what you owe for today, or it might be covered through your insurance if you have your provider's card ready for her. But other than that, I like what I'm seeing. You don't need to be here any longer. Go and enjoy yourself. We'll see you later. Take care.